So I'd like to welcome Dr. Balakrishnan to the podium. He's going to talk a bit about atypical mycobacterial infections. And Dr. Balakrishnan is one of our pediatric otolaryngologists up in Rochester. And
thank you, Dr. Driscoll. Thank you for coming. I'll talk to you a little bit about management of non-tuberculous mycobacterial head and neck infections in children. So I have no disclosures. So the objectives are going to be just a quick review of the microbiology and epidemiology of these infections, review some of their clinical manifestations, though many of you have probably seen many of these already, review some management options, and try to present a somewhat evidence-driven approach to decision-making with these. So the historical perspective, because we always have to have some Mayo history, right? Acid-fast bacterial infections in the cervical lymph nodes were described in children in the 50s first. And of course, Mayo Clinic was there. So one of the two initial reports was by a Mayo Clinic group. The other was by a group in France. And they didn't specify what the exact organism was. They just said it stained acid-fast. Later on, over the following decades, then people started to differentiate these from Mycobacterium tuberculosis, and identified them as non-tuberculous mycobacteria. So many of you probably have used or heard the term atypical mycobacteria. That is a very common term. It's perfectly fine. In the infectious disease literature, they've tended more to start calling it non-tuberculous mycobacteria or NTM. So that's probably going to become the more standard term over time. And starting in 1980, more detailed reports of these organisms causing cervical lymphadenitis and other head and neck infections started to come out. So the epidemiology, interestingly, the head and neck infection incidence seems to vary geographically across the US, and Dr. Kofer, one of my colleagues, has a study going actually to look at that. But similar to tuberculosis, there does seem to be some seasonality to it. It seems to peak in the late winter and early spring, basically during abscess season. In children, at least, by far the most common manifestation of these infections is lymphadenitis. Over 3/4 of these infections are lymphadenitis. And it is the most common cause of chronic cervical lymphadenitis in children. So just something to think about. Obviously, and we'll talk a little bit about the clinical manifestations and time frames that these happen over, but if you have a patient with chronic progressive or persistent lymphadenitis, think about these. Most commonly happens in children under age 5. And so the clinical presentation, again, this is very slowly